India has an estimated 101 to 212 million people living with diabetes, which is almost equal to one quarter of all the diabetes globally. Most of the diabetic patients think that if the normal blood sugar reading taken today is normal, means sugar is controlled for the last few months. Actually, it is not like so. That's why doctors recommend two important tests: blood sugar test and HbA1c test. In this video, I will explain what these tests are, how they are different, what the normal values are, and when you should get tested. Sugar, also called blood glucose, it is amount of glucose present in your blood. Your body uses glucose as its main source of energy. The hormone insulin helps move glucose from the blood into your body cells. If there isn't enough insulin or your body cannot use insulin properly, blood sugar levels rise, leading to diabetes. A blood sugar test measures the amount of glucose in your blood at that specific moment. Sugar tests include fasting, postprandial, and random. Fasting blood sugar is taken after fasting for 8 to 12 hours. For a normal person, its value is below 100. For pre-diabetic person, it is in between 100 to 125. For a diabetic person, it is 126 or higher. Postprandial blood sugar is measured 2 hours after a meal. For a normal person, it is below 140. For a pre-diabetic person, in between 140 to 199. And for a diabetic person, it is 200 or higher. Random blood sugar can be done anytime.
HbA1C stands for glycated hemoglobin. When glucose circulates in the blood, some of it attaches to hemoglobin inside red blood cells. Since red blood cells live for about 120 days, the HbA1C test reflects your average blood sugar over the past 2 to 3 months. Unlike a regular blood sugar test, HbA1C is not affected by what you ate today. It provides a broader picture of long-term blood sugar control.
HbA1c values for a normal person is below 5.7%. For a pre-diabetic person, it is in between 5.7 to 6.4%. For a diabetic person, it is 6.5% or higher. Diabetic persons shall aim for HbA1c value less than 7%. Because HbA1c reflects your average blood sugar over the past 2 to 3 months, it does not change overnight. If the value lies between 6.5 to 7.5, it may take 2 to 3 months. If it lies 7.5 to 9, it may take 3 to 6 months. If the value lies above 9%, it may take 6 to 12 months or even more to become normal HbA1 value. HbA1c value will not become normal overnight. If the cup represents red cells with high HbA1c value, it will take some time to become normal. Difference between blood sugar test and HbA1c test. Blood sugar test shows current blood sugar, whereas HbA1c shows the average of last 2 to 3 months. Blood sugar test can change throughout the day, but HbA1 test is more stable. Blood sugar test often requires fasting, but HbA1 test not required. Blood sugar test useful for daily monitoring only. HbA1c test is useful for long-term diabetic management. Persons over 35 years old, overweight or obese, or with a family history of diabetes, or with high blood pressure or with high cholesterol may be tested for sugar test. Symptoms of high blood sugar are frequent urination, excessive thirst, increased hunger, fatigue, blurred vision, slow healing wounds, frequent infections, unexplained weight loss. To prevent diabetes, eat a balanced diet rich in vegetables, whole grains, legumes, and lean protein. Limit sugary drinks and highly processed foods. Exercise for at least 150 minutes per week. Maintain a healthy weight. Get enough sleep. Avoid tobacco use. Blood sugar test means current sugar level. HbA1C test means average blood sugar over the last 2 to 3 months. To know the diabetic condition, go for HbA1C test only. Thank you.